Once again, this is Dr. Hatem El-Aishi from Dr. Hatem El-Aishi Medical Center in Cairo, Egypt. Building the medication prescription for a patient with an autoimmune rheumatic disease. How we build the prescription. So getting closer now to how doctors build the medication prescription for a patient with an autoimmune rheumatic disease. A typical prescription should be like this. On the left side, you have medications for treatment. On the right side, medications for pain killing. Medications for treatment. Non-biological DMARDs that inhibit the officer cells or biological DMARDs that inhibit the driver molecules. This is concerning the medications for treatment. For the pain killing, we mostly have the NSAIDs and can be other types of painkillers, of course, as we mentioned in a video before about easing the pain in arthritis patients. So medications for treatment are like the main course, and medications for pain killing are like the side orders of the prescription of the patient. So the main course, which includes the non-biological and the biological DMARDs, is long-term, variable duration, but it is long-term. And the NSAIDs, the side orders, they are initially short-term, then should be used as needed if this is a successful treatment plan or a successful prescription for the patient. More detail. The main medications. How we prescribe the non-biological DMARDs. We prescribe the non-biological DMARDs, one or more than one together at the same time, which means that we combine. So we can combine several of those medications together, but we need to follow certain guidelines for combining them. A biological DMARD can be added to medications from the above category, or can be the only medication sometimes. Whether added to them or prescribed without them, it is always one, never more than one at the same time, the biological medication. Complementary medications, those are the NSAIDs or the cortisones. An NSAID, only one at a time, or a cortisone, only one at a time. It is not a very good idea to combine an NSAID with a cortisone medication. Stomach upset will be more likely, although it happens for a very short period sometimes, but it is not a good idea to do it at all. So we have a main medication and we have complementary or accessory or side medications. Concerning the main medications, any other items on the main medication prescription? Yes. There are other types of medications or treatment methods available, but that are not part of the current everyday practice or part of the international guidelines right now. They are like stem cell therapy and personalized medicine approaches. Stem cell therapy, it's a past that has not found its way. Maybe it was successful in other disorders, but not in the autoimmune rheumatic disorders really. And personalized medicine, this is a future that will eventually find its way in the coming years. The DMARD prescription is the way of treatment in action at this point in time. How about the complementary medications? Any other items on the complementary or the side order medications? Yes. Certain supplements or medications are also prescribed for one of the following reasons. Number one. Number one, proven anti-inflammatory effects. Fish oils, the only supplement with proven scientific evidence that it helps in patients with autoimmune arthritis, like rheumatoid arthritis in particular, are fish oils. They also have other health benefits apart from their anti-inflammatory effect on the joints. Number two, to decrease the possible side effects of a prescribed medication. If we prescribe methotrexate or cilazopirin, we prescribe folic acid. If we prescribe cortisone, we prescribe calcium and vitamin D. If we prescribe NSAIDs, we prescribe stomach acid suppressors. We call them proton pump inhibitors. Number three, to stop or control certain side effects that already happen. If liver enzymes go up, we sometimes prescribe liver tonics. Let me comment on liver enzymes going up, because some patients are very worried when this happens. This is a mostly transient thing that can happen with some medications, and that is not serious at all, but that requires temporary reduction of some medication doses with or without prescription of liver tonics, and then the medication doses are resumed again when the enzymes are back to normal. Number 4, why we prescribe extra complementary medications to prevent the long-term problems with a chronic inflammation. Bone weakening, for example. Bone weakening might occur with chronic inflammation, any chronic inflammation. This makes patients more susceptible to fracture with minor falls. We call this condition osteoporosis. Doctors check for it with DEXA scans and prescribe treatments if necessary. Cardiovascular disease also. Cholesterol can deposit in arteries in chronic inflammation, a condition called atherosclerosis. In high-risk patients, certain measures are taken and certain medications might be prescribed. Number 5, to prevent certain infections in more susceptible patients, immunizations with influenza vaccine and pneumococcal vaccine are two famous immunizations that we prescribe to patients with autoimmune rheumatic diseases. Number 6, to manage symptoms of other organs and system affection in this autoimmune rheumatic disease. Why would we need that? Why would we need to control the symptoms of other organs in an autoimmune rheumatic disease? Remember the definition of autoimmune rheumatic disease at the start of the series in the first video? Autoimmune rheumatic diseases are a group of several different diseases that can affect the joints of the body, and in addition, they might also affect other selected body organs sometimes. Eye, thyroid, lung, brain, intestine, heart, stomach, liver, kidney. So, what might we need for symptom management in other organs? Just like the attack of antibodies to joints releases prostaglandins, and prostaglandins cause symptoms and signs of inflammation, pain, swelling, tenderness, stiffness, and so on. And that's why, apart from treatments, DMARDs that control the disease activity, we need to prescribe an NSAID for the symptoms. Likewise, attacks of antibodies to the lung, for example, or the eye, or the kidneys, releases different combinations of different types of ouch molecules or inflammation molecules, ongoing inflammation molecules, that contribute to symptoms and signs of the disease. Shortness of breath in the lung, for example, eye redness and blurring from the eye, and little urine volume, and maybe blood pressure goes up. And so we need to prescribe certain medications in each of those cases to control those symptoms until any prescribed DMARDs start to take control of the disease.